I want to welcome you. So my name is Joe or Josina Romet O'Connell. I'm the director of Colorado AHEC, and I'm here to welcome you to this session of Frontiers in Medicine in our Colorado AHEC Mini Med series. We're joined remotely by scores of learners and by our presenter from a different area of Colorado than Denver Metro. I wanted to let you know that next week's session is called Danger in the Air, a discussion of health risks from airborne toxins by Colette Robinson. It is also our April-October 2024 graduation, so be there. There's going to be cake and drinks. If you attended 6 sessions, you'll receive the Colorado AHEC Mini Med diploma. If you attended all 8 sessions, you'll receive the diploma and the Mini Med lapel pin. Our April 2025 sessions will be all virtual oldies but goodies, which will finally get us on track to offer Mini Med consistent with the actual academic year calendar. We will, of course, be updating you as we get closer with all the ifs, ands, or buts. So it's my pleasure and honor to introduce tonight's session of Frontiers in Medicine, and it's being presented from Mesa County, Colorado. It's called Vaccines Increasing Understanding, and I'm honored to present Dr. Korrey Klein, MD. Dr. Klein is president and CEO of Family Health West. As a Colorado native, he's spent most of his career in rural healthcare. He has a Bachelor of Science in Business Administration and graduated from the University of Colorado School of Medicine, right here, and is board certified in family medicine. As the largest employer in Fruita, Colorado, he oversees nearly 600 employees delivering a range of healthcare services, including a critical access hospital, primary care, outpatient specialty practices, and secure assisted living. As part of his commitment to outreach and education, Dr. Klein has presented locally and nationally on a whole bunch of medical and healthcare finance topics. Dr. Klein, take it away.
Thank you very much. Welcome, everyone. I already had a great introduction of myself, so thank you, Doctor, for that. If you're kind of wondering, though, I'll give you a little update. When I graduated from high school, I didn't know what I wanted to be when I grew up. So when I went to college, I decided I'd get a degree in business. And then I decided to go to medical school, but I didn't think I'd get in. So I decided to keep my business degree. And so I graduated with a bachelor's in business administration with minors in chemistry and accounting. And I haven't found another family doctor that quite looks like that. Then I went to family medicine residency, started out at a critical access hospital in Rifle, Colorado. And then I came back into Fruita, Colorado, and I was in private practice. And about 4 years in, we lost our practice manager. And I started doing the payroll as a side gig temporarily for 7 years. Then I started to realize what my business degree maybe was helpful for. But then I was asked to be the chief medical officer of Family Health West. And I was actually the first ever chief medical officer of this small hospital. And then 6 months later, I was asked to be the CEO, or was approved to be the CEO by our governing board. And that was in August of 2019, right before a thing called COVID happened. So I don't know what a normal CEO looks like, but I think I was very fortunate to be a physician CEO right as we went into COVID. As was stated, I've presented on a range of topics on the business of medicine and value-based care, as well as these topics. And tonight I'm going to share a little bit about vaccine. And the goal of my presentation is really just to provide a little bit more broader understanding of vaccines, how they work, and because this is an adult audience, I'm going to be talking a little bit about adult vaccines. I always start every presentation because I'm the CEO of Family Health West with our mission statement. And I always tell people that we don't always fix people in healthcare. Sometimes because they're not even the patient, it might be a family member or a caregiver, but we can make every patient's day a little bit better. And we try to make everybody's day a little bit better, even if we can't necessarily fix their problem. That's what we strive for at Family Health West. I do this for free. I don't have any conflicts of interest or disclosures. We're going to talk a little bit about how the human immune system works. This is very simplified. I fully admit that I am not a professor at the medical school, and they can explain it in much greater detail than me, but I am a family doctor, and it's my job to help educate patients about their bodies, and that's the level that this is aimed at. So a very practical level. And then how the immune system works, how do then vaccines interact with the human body, and then how do we go about deciding what vaccines are the right choice for us as human beings? And then, of course, we'll then talk a little bit, we'll integrate that a little bit into some specific vaccines and how they work and why you might choose them. So first, how do vaccines work? First of all, you have to understand that there are 30 trillion cells in the human body, and there are millions of outside invaders always working against us. And those come in different varieties, and we classify them a lot on how they work, their internal parts, and how they interact with their surroundings. And so most people understand that there are bacteria out there and there are viruses, and how they work are actually different. But there's also fungi and parasites. There's also things that invade or attack our body that are harmful. Those can be chemicals, immunodisruptors, toxins. The medicines that we take can be harmful in the wrong doses or for the wrong maladies. And then, of course, our own bodies are sometimes stacked against us. And so our cells are constantly turning over. We create new cells. We have cells that are dying off. We have cells that quit functioning as they're intended. And we often have unregulated cell growth, which we commonly call cancer. And so for my talk, I like to keep things simple. And so when we're talking about the human body and we're talking about things that are not ours, we in medicine call them antigens. But to keep it very simple, any of those things that are not human cells, that are not productive inside our cells, or things that attack our cells, those can be antigens. But we can also use antigens for good when we know how our body reacts and treats antigens. And so when we talk about vaccine, what we're really talking about is introducing an outside substance to our body, allowing our immune system to do its normal activity and create immunity. And so when we're talking about vaccines and we talk about what's in the vaccine that's doing the work of creating immunity, we use the word antigen. And that's really a thing that's not yours that we use to have your body respond to it. And most vaccines contain one or two of these antigens. But as we'll see as the talk goes on, there are vaccines that actually contain a lot more antigens. But I think the really important thing, and what a lot of people don't understand, is our bodies come into contact with somewhere between 6 and 10,000 new antigens every single day. And our bodies are really, really good at dealing with foreign things trying to harm us. And so our immune system does a very, very good job of protecting ourselves. And when you put vaccine into context, one or two antigens out of 6 or 10,000 different antigens our bodies are used to seeing per day really is a small amount. So when we talk about vaccines, I always hear a lot of concern, especially from parents, about saying, well, I don't know if my kid should get more than one shot because I don't want to overwhelm their immune system. We're really talking about an immune system that is very, very capable of taking care of the antigens that we find in vaccine. Also, when we talk about the immune system, we also have natural protection too. So it's not just our immune system. A lot of us think about antibodies floating through our bloodstream, but there's a lot of other protective mechanisms that help our immune system work. And that's the first one, is the very obvious thing. It's our skin. It's a protective layer that keeps invaders out. But there's also mucus, that sticky stuff in our nose. There's acid in our stomach. There's immunoglobulins in our airway and things like that. And then there's also just how we digest things that come into our stomach. There are ways the body protects us. And I think that's really important when we think about how that works. We also, when we talk about vaccines, have to realize, though, that that first pass protection sometimes inhibits how vaccines work. So that's why we can't give vaccines through the skin, for example, because sometimes the skin keeps antigens out. That's its design. Or our stomach acid might actually digest an antigen. And so that's why a lot of times we have to give vaccines in ways that are different from other things. And that's why sometimes we have to give them in the form of vaccination shots or injections, is because we have to go around some of our natural barrier protection as well. When we talk about our immune system, though, this gets super complicated. In fact, in medical school, there is lecture upon lecture of how this works. And so, as a family doctor, is how do you distill a very complicated immune system down to a person who's trying to understand um, how things work? And so I distilled it. So me, a physician, but certainly not an academic on the immune system. How do I define it? And so I keep it as simple as I can. And so there is the innate response, and that's the non-specific general defenses. That's the things I was talking about with your skin and your digestive tract, and they contain cells that I like to say eat things. So those are neutrophils, macrophages, dendritic cells, monocytes, mast cells, and also something we call natural killer cells. And they're sort of our first line of defense. They're not smart in terms of being specific to invaders. They just know that if there are certain things that don't look like you, they respond. And then there's an adaptive response, and that's sort of the learned defense. And so you can see in my slide that your body has to detect that something is an outside invader, that the antigen is present. And then it has to do something about that. And then it creates an immune response. And then it has to kind of figure out what to do with it once you develop immune response. So sort of an inflammatory response, a histamine response, there's immune helpers, and then it has to remember that for tomorrow. Otherwise, it has to start the process all over again. And that is a very complicated interaction between several different types of cells. But the easiest way to think about it is there's an antigen, it's presented to your immune system does things in response to that. And there's two things that happen. One, get rid of the antigen, get rid of the invader. And then the second thing is what to do about the invader that looks like it. So there's an immediate response. So if there's one invader, there might be more than one. And what if we see that invader again in the future? And so when we think of vaccine, what we're really trying to create is not necessarily the immediate response, but that future response of when your body sees the invader again. And then the last thing is passive immunity. And I like to think that as shared or borrowed immunity. And the most common one is actually mom's milk. And so by breastfeeding an infant, we know that there's some immunity that the child gets from mom's immune system through that mechanism. But there's a lot of advancement in medicine right now, especially it happened with COVID, but also in a lot of our understanding of the immune system of how can we borrow someone else's immune response? And we often call those immunoglobulins. And sometimes those immunoglobulins can be sort of manufactured or created, or sometimes they're even borrowed through transfusion and from someone that we know is immune. And there's a lot of advancement in medicine. And again, this is very complicated, and I've put it in a very simple slide. But I think it helps to understand if we know how the immune system works, then we can go forward with saying, how do we create a vaccine? There is a flip side, though, to immunity that I think we have to understand, and that is immunity is good and it's great when it works well, but what happens when the body doesn't have a normal immune response? And I think this is really important to understand when you're looking at vaccine, because if you're looking at vaccine safety, you have to say, what happens to a person who accepts a vaccine and their immune system doesn't work correctly? Or what happens if you take a vaccine and your immune system doesn't work like in a normal fashion? And so we actually have a lot of understanding in medicine, actually, of when the immune system it doesn't work quite right. And so one of those things is called autoimmunity or an autoimmune condition. If you've ever heard those words before, that's really a condition where your own immune system doesn't quite work normally in the sense that instead of seeing foreign invaders or antigens from outside the human body, it actually is looking at your normal body and it's recognizing it as foreign and it's creating an immune response. And so the best way to remember this is your immune system function is normal, but the target is wrong. So it's targeting your own body, but it's actually doing what it's designed to do, which is generate an immune response to a foreign invader. The problem is the foreign invader is you. There's also when your immune system doesn't act normally and it's too aggressive, and you get an overwhelming immune response that's inappropriate. And the most common one that people know is allergic reactions. And so that's where your immune system regulation isn't quite normal, and sometimes that's because of repeated exposure to a foreign substance. Sometimes it's the first time you're exposed to a substance, but it's when your body's immune system overreacts and is overregulated. And then there's the opposite of that. There's an underactive immunity, and that's a failure to respond appropriately. And in medical school and they teach of an enormous amount of primary immunodeficiencies. In fact, they like to test you on all of that stuff. And as a family doctor, it hurts my brain to think of all of those kinds of things and how you'd get them right on a test question. But I think the important thing is a lot of these are acquired, or I mean, they're primary. In other words, the child is born with their immune system not working quite right. And the reality of it is no matter what you call it, if your immune system doesn't work quite right, those people become chronically ill because they can't keep the foreign invaders out. And depending on the medical condition, that can be so maladaptive that they can't survive in our world without significant help or maybe even at all. Sometimes those people can be able to survive, but we have to intervene medically. And then, of course, you can break the immune system after it's been working normally. And we call that acquired immunodeficiency. And that really means you can't fight an infection. And the most common people know is HIV, because that's pretty well known in the world. Although when I went to medical school, it was a very new topic, this human immunodeficiency virus. And who could get it, how you got it, and stuff like that was a subject of actually debate back then, although I think we were understanding it a lot more than even the few years prior to that, in the decade prior to that. And then there's also acquired immunodeficiencies when your immune system is broken, where that most people understand as lymphoma or leukemias. And so I think it's really important to understand that when you're talking about, can my body take a vaccine? The understanding is if your immune system isn't working correctly, you'll probably know, because you might have an allergic reaction to something. You might be sensitive to certain outside antigens. You might have an autoimmune disease. You might even take medicine for an autoimmune disease, or you might be taking a treatment for a cancer or something like that. So it's really important to know that if you're going to take a vaccine, you have to know if your immune system is working correctly, because that might affect when you take the vaccine. If you take a vaccine, is the vaccine actually going to provide you defense? But there's a flip side to that. When people are concerned about whether to take a vaccine because they're worried that their body is going to not whether the vaccine is safe, if they have a normally working immune system, they may not develop immunity, but it doesn't mean that the vaccine is inherently harmful to them. So what exactly is a vaccine? And so I go back to the beginning, and I am also not a medical historian. I'm a family doctor, but I think it's really interesting to understand that there are a lot of people think that vaccines are new, and they're really not. We've had an understanding of the immune system since the 1700s, even before that. But the English physician Edward Jenner is often given credit for the understanding that the immunity existed. And what happened was he found that that milkmaids that had previous infections with cowpox didn't seem to get smallpox. And it was obvious enough that he wanted to try it. And so he intentionally infected, which would violate every ethical norm in medicine today, an 8-year-old named James Phipps with cowpox. And he used an infected open sore. And I don't know about you, but as a medical professional now, that makes me just totally shudder. But interestingly, this boy fully recovered, and 2 months later, he exposed him to smallpox, and he didn't have an infection, and published his findings in 1801. And so this intentional exposure then prevented future infection was some of the first understanding that the body was capable of developing a defense for future infections. And so the actual word vaccine actually comes from the Latin for vacca or cow. The first vaccine actually was for cholera, was produced by Louis Pasteur in 1872. So that's also interesting too. It took almost another 80 years before we could come up with a vaccine to prevent a disease without infecting somebody directly. I also grew up in the 80s and before the advent of chickenpox vaccine. And so even though vaccines have been around since 1872, it wasn't uncommon and, in fact, intentional in my household to expose children to chickenpox to become immune and get the disease out of the way for the future. So my loving mother exposed my chickenpox infected brother to his 2 other brothers so that we could all have chickenpox at the same time. And that was normal. That was the norm back then. And now I'm a family physician who has seen 2 cases of chickenpox in my entire career and wild type chickenpox infections, where that was a family medicine common, normal disease process that was seen in clinic. And so that's pretty amazing how far vaccine has prevented that particular disease. So how does a vaccine work? And so first of all, you must have a normal immune system because vaccines actually use normal immune processes. And in fact, if you don't have a normal immune process, you probably don't generate long-term immunity. And so what does that mean? Well, as part of your immune system, then your bone marrow, so all of those infection-fighting cells that I was talking about previously are created in the bone marrow, and they also your lymph nodes and your normal developmental process of your immune system have to be working correctly. And also your spleen is a very important part of your immune system. And so it must be present for some vaccines, especially for encapsulated organisms, to develop a normal immune response. And so sometimes we change our vaccine recommendations, for example, if you're missing your spleen. And then you cannot be on immune suppressing medications. And I found this very, very common actually during the COVID pandemic, because as COVID vaccine came out, the elderly and high risk people that wanted the vaccine, some of them were coming on immunomodulating medications, or they were on immunosuppressing medications and they wanted the vaccine. And they said, should I get it? And I said, well, I don't know. Maybe you should talk to your doctor. And they said, well, I'm on chemotherapy drugs. And I said, well, you really should talk to your doctor then, because the vaccine may not work. The American College of Rheumatology actually came out with recommendations on when to accept a vaccine based on the schedule of certain rheumatology drugs that mediate through the immune system. And so That's one of the primary considerations too of should I get a vaccine? Well, it depends on your immune system and where you're at if you're taking medicines. So how does a vaccine work? You introduce a piece of the thing you're trying to build immunity to, and that piece is an antigen, it's a foreign invader, and you present it to your immune system, and you hope your immune system does its thing. But I told you we have some innate immunity, like our skin, so we have to get around that. And so almost all vaccines, we introduce the antigen through something that's bypasses our skin. So we can do that through our mucous membranes, through our nose. We can swallow a vaccine, or we can inject it. We can go through the skin and inject a vaccine into our bodies. And one of the things that I think that we all love with vaccine is we try to avoid making the patient sicker than the disease process itself. Now that sounds kind of silly, but if you think about chickenpox and the way my mother created immunity for chickenpox, is there was a risk that I could be sicker than my brother. And in fact, that was one of the problems with the first live vaccines or introducing people to a disease was sometimes people died from the treatment. And so in general, we try to create vaccine that makes you less sick. And so how do we do that? Well, sometimes we take the thing that we're looking to make a vaccine for and we kill it off or we weaken it. So it's still alive, but not nearly as infectious, not nearly as severe of a reaction. Or we chop it up. We take pieces of the actual or replicated pieces of the actual virus, and we try to present just a piece of that virus. And because the immune system, often the first thing they see is the outside of a bacteria or a virus, the piece we try to present is the first thing the immune system would see. And the hope there then is later, if you're going to come into contact with that disease, your immune system is already prepared because it's seeing the outside of the virus and is already generating immune response before the inside parts are exposed to our bodies, because that hopefully then gets an immune response before the virus has a chance to replicate inside our bodies and make us sick. And then the immune response then is our body's natural defenses building long-term immunity. So the next time the actual disease itself presents, the body's primed, ready to go, and you get less sick or not sick at all, and even though you come into contact with the disease. So once you have this piece of the antigen, this piece of the virus, this replicated, this dead, this weakened part, then you have to figure out, well, how much of this virus or piece of a virus would your body have to see before it develops an immune response? Because again, remember, if your body sees between 6 and 10,000 new antigens a day, sometimes your body thinks it's really important. Sometimes those macrophages, natural killers, just eat it and move on, and you don't actually develop an immune response. So researchers then have to sort of figure that out. So they figure out then how much of it does your body need for you to likely develop a dose. Sometimes your body needs to see it more than once. So should we actually give you 2 doses rather than maybe 1 big dose? Maybe you need 2 small doses. Maybe you need 3 doses. And then how far apart should those doses be so that you develop long-term immunity? And so that's why when you look at vaccines, some of them you can get 1 dose and be done. Sometimes you get multiple doses. And even then, sometimes you don't build an immune response. And so sometimes patients ask me, well, why do I have to have 3 doses of hepatitis B vaccine? And I say, well, it's statistics, it's math. And they say, math? I thought this was science. And you say math because we know that 3 doses of hepatitis vaccine at today, 2 months from now, and 6 months from now is statistically giving most people an immune response. And that response, that effectiveness varies, but they generally look for a response at least above 80%, that kind of thing. And I'm a classic example of that. When I got into medical school, they tested me for immunity to hepatitis B. And even though I'd had 3 doses of vaccine, I was not immune, and I received a 4th dose of vaccine. And then I showed an immune response to hepatitis B. So, but I think that's important to note that that's math and statistics, not science. And the reason I say that is because just because you receive a vaccine does not guarantee immunity. And so that's really important when you're looking at disease prevention or risks of reinfection or something like that. That's also why we test new pregnant women for immunity from certain diseases that put them at risk, because it gives us an opportunity to intervene and perhaps give them another vaccine to protect them before the baby is born, or perhaps protect the infant itself. And so that's why part of the guidelines for maternity care include testing for immunity. So vaccine recommendations. So how would you know about, so I told you this is math. And so for me, math is hard to remember, and it changes all the time as we apply more science to vaccines and as new vaccines come out. And so I don't like to remember that stuff. Um, and there's also, it might depend on who you are. And so when you're thinking about what vaccine should I take, I always say, always consult your doctor before accepting a vaccine. So I know pharmacies will give you a free ham for Thanksgiving, or free turkey if you get your vaccine at their pharmacy. But you may be taking medicines that affect your ability to develop an immune response. Maybe you don't need the vaccine at all. Maybe it's not recommended for your age group. Maybe you just want to have a conversation with your doctor about which vaccine is right for you. So when I talk about factors for vaccine selection, I always say talk to your doctor. I commonly get questions based on age. What should my kids receive? What do they need to receive before they go to school? Should my kid get this vaccine? I've heard about this new vaccine. I want to know information about my teenager getting this vaccine for something called meningitis. And then I get adults who want to know this as well. And the most common in the middle age adults is travel. And so they're saying, well, I'm traveling to a foreign country. Should I get vaccines that I don't normally get? And so I show this all the time. You can go to cdc.gov, find the travel section, find destinations, go to the list, find the country you're traveling to, and they do an amazing job of not just vaccines, but even other preventative things that you might want to think about, such as malaria prophylaxis, things like that. It goes even a step further to say which malaria prophylaxis medicines work in that particular area of the world and which ones should you avoid. And you don't need to be a physician to look at that. It's available right there on the internet, but I think it's a trusted resource to say, should I get yellow fever vaccine, things like that, so that you can educate yourself on those particular vaccines. And then, of course, as I've already talked about, your medical history, if you have immune system problems, that affects it. And then also exposures. So again, travel, but also are you perhaps exposed to tick-borne illnesses? Are you mosquito-borne illnesses in equatorial countries? Things like that. So your exposure level might dictate whether you should get a vaccine. And then your past medical history. Have you had allergies to vaccines before? Maybe you should consider getting a different type of vaccine. And also religious beliefs and institutional trust are major factors in whether people receive vaccines and which vaccines that they should receive. So where do I go to remember? I go to the Center for Disease Control, and you can look up schedules. And but the American Academy of Pediatrics, the American Academy of Family Physicians, they all come out with immunization schedules. I would say that most of them are patterned after the Center for Disease Control data. Some drug companies, pharmaceutical companies, also come up with their own vaccine schedules. Again, we talked about institutions of trust. I tend to be a little more personally distrustful of their schedules. I really like to see the CDC make their recommendations first on vaccines before I have more trust on the schedule. And then as I shared, because of your medical history, it's not one size fits all. The other thing I like about the CDC is you can read their notes, you can read their color coding, and make shared decision making with patients on which vaccine is right for them. This list I'm showing you here is just a tiny little list, because if I put the whole thing on the slide, you wouldn't be able to read it. And they also make a similar list for children. I think the really complicated thing in family medicine is to try to limit the number of shots a child gets. They make all sorts of variations of different mixtures of these vaccines. And sometimes that gets really difficult as a physician trying to make recommendations to a parent of, I know which vaccines they need, but the mixtures of vaccines in my clinic may not match the mixture of vaccines in a different pediatric clinic or a family medicine clinic or a public health clinic. And then sometimes it's hard to align with the recommendations, because I'm like, well, they don't need another one of these, but they do need another one of these. And that can be very frustrating at times, or subject the child to having more pokes to get the same number of vaccines. And so one of the things that is interesting, or it's something worth talking about your doctor, is I want my child to get shots. Do I stay with a certain vaccine series, a certain mixture, because then I know it's going to create the least amount of injections for my child. And to show you the different things here too, rotavirus is an oral vaccine. Most of the others are injection, but they actually make nasal influenza vaccine too. So again, all three routes are ways we can get vaccine into the human body. So to demonstrate the different antigens, the different way they make vaccines, and to kind of stimulate discussion about it, I give a few vaccines examples, and we'll talk about a few of them. We have about 10 minutes left before we go to questions. We may or may not get to all of my examples, but that's okay, because all of this information is on the internet. I don't claim any of this as my own. This is all publicly available. And so for my talk, most of my talk came from the CDC or from trusted websites. I take no credit for it, but I also don't have any monetary view from it. For the vaccines and all of this data, to be fair to the vaccine manufacturers, all of the data literally comes off of the studies that were used to approve these vaccines. So the reason I'm caveating that is because the studies that are used to approve the vaccines, sometimes science doesn't stop there. And so we keep studying vaccines. For example, we might study vaccines over time. So the vaccine was approved here, but we might study that vaccine for another 5 or 10 years. The other thing is because those are typically done by the drug manufacturers, sometimes we study them in academics, like we might compare one vaccine against another vaccine to see which one is more effective. That's not demonstrated here. That is other data. So I wanted to be fair. All of this came directly off of the manufacturing label for these vaccines that was used for approval of the vaccine. So the first vaccine is respiratory syncytial virus vaccine. The reason I chose this vaccine is it's kind of RSV vaccine for adults is actually kind of new, because we've been giving it to kids for a long time, but we found that actually adults are suffering from RSV because we're noticing there's a lack of immunity in older adults. And so there is actually 3 vaccines. It is 1 dose, no matter which vaccine you choose. It's recommended in adults 60 years of age and older. They really want to focus on adults 60 to 74 if they're at increased risk for having disease or having complications from getting RSV, and then everyone over the age of 75. And the other reason I like this particular vaccine type is because these 3 different manufacturers, all 3 make it in a little bit different way, but they all target the same antigen. So these are really good example of trying to demonstrate all that I've been talking about today about how to make a vaccine and how it interacts with the human body. So GlaxoSmithKline makes a medication called, or a vaccine called Arexvy, and it's the RSV pre-F3 subunit. So that is the what the piece of RSV that they use, and they mix it with something so that they can use a lower amount of the antigen, but they want to create more immune response. And so that's called an AS01E adjuvant. Almost all the adjuvants are proprietary with the manufacturer. So you'll often see GlaxoSmithKline vaccines all contain AS01E adjuvant because they continue to use their own proprietary thing. But you can see that it does not contain any live virus. It doesn't contain mRNA. It contains this subunit of the RSV, and they add a booster to it. And you can see that in the clinical trial where they got approval, the effectiveness rate was 74.5%. So that means that it prevented disease in the clinical study 74.5% of the time. That still says that 1 out of 4 individuals who received the vaccine still were not immune. And then Pfizer makes one called, I don't know how to say it, Abrysvo. It's a bivalent vaccine. And so they took the pre-fusion F protein subunit, so that same thing that GlaxoSmithKline did, but they took it off of RSV-A, and they took it off of RSV-B, and they mixed it together. So that's what we call a bivalent vaccine. It was approved by the FDA in May of 2023. It also has no live virus, there's no mRNA, but by mixing it together, they were able to get an effectiveness rate of 77.8%. So this kind of shows you that by taking a few different parts and mixing them together, they were able to achieve a more effective vaccine. And then Moderna made a pre-fusion F glycoprotein vaccine that's made from mRNA. But interestingly, it doesn't seem to last very long, and its effectiveness rate is only 47.4%, even though it's using that same pre-fusion F glycoprotein. But because it's using mRNA to build that, it actually didn't work nearly as well as the other two. And I think that is really important, so that it shows that how you make the vaccine and the antigen that you use are all factors in how well a vaccine works. And so that's why I really like to use this vaccine as an example. Another one I like to show is shingles, because the recommendations have changed. So shingles vaccine it's recommended to have 2 doses, 2 to 6 months apart. It's recommended in adults age 50 and older, or even greater than age 19 if your immune system doesn't work quite correctly. And you can't have active shingles, and you can't be pregnant. I always say that to my older adults, and they always laugh because I say, I assure you, I'm not pregnant. But I think it's a good thing to always ask the question. So there are 2 of them. Merck made one called Zostavax. That's the one I grew up with in family medicine. And we gave it a lot. But interestingly, it was discontinued in 2020 because it didn't work very well. And in fact, if you had Zoster vaccine, they now recommend you go ahead and get the updated vaccine. So GlaxoSmithKline makes one called Shingrix. And by the way, I'm using the brand names because oftentimes the generic names don't make any sense, or they're hard to pronounce. And I'm in no way endorsing any of these vaccines. I am just telling you the differences between them, because the point of the talk is to demonstrate differences between them. So this one is lyophilized GE antigen with an AS01B adjuvant. Basically, they take a fat molecule and they apply it to the antigen, and they mix it with a power booster for your immune system. And so it doesn't contain a live virus, and it doesn't contain mRNA. It was approved in 2017. But look how effective this one is compared to the RSV vaccine. So in shingles prevention, it was 96.6% effective in the 50 to 59 age group, 97.4% in the 60 to 69, and 91% effective in the age over 73. And it's still effective even at 7 years. It's been studied for 7 years and it's still effective, 84% effective. That just shows you how effective this vaccine is compared to an older vaccine, and how this antigen that they created mixed with this power booster for your immune system, how effective that happens to be for this particular vaccine. So you might be asking the question then, why do you sometimes need 1 dose or 2 dose or 6 doses, or why is 1 dose so effective? And sometimes that's how the vaccine is made. Sometimes that's the antigen that it's attacking. Sometimes it's the behavior of the target. And so if you have a target that likes to mutate or change or shift or hide from the immune system, then vaccines don't tend to last very long. And that brings us to influenza vaccine. And so the influenza virus, it really likes to trade parts with itself and trade parts with the other influenza viruses. And so when it shifts amongst itself, we call that antigenic shift. When it changes, we call that mutations. And so this is a really great example of a vaccine that actually has different ways it's made. So there's actually dead or inactivated virus. They make some virus that's recombinant that contains just some parts. And they also take the live virus and they weaken it and they put it into a nasal spray. And so there's actually a live attenuated nasal spray, although it's not recommended for adults over the age of 50. And so that's all I'm going to really say. And actually, I think we're at time. But that's just kind of an example of how they can create a vaccine that actually contains different ways we make vaccines. So we didn't get to pneumonia. We didn't get to COVID-19 vaccine. But we did cover, I think, some very important examples of how the body works normally, how vaccines interact with the human body, and a few examples of how vaccines can be created to create immunity to certain diseases.
Well, thank you, Dr. Klein. We are at 8 o'clock exactly. I just want to say again, thank you for your time tonight, Dr. Klein, and this was awesome learning. Thank you so much.
Thank you. That's the goal of all my presentations, is hopefully I shared something that people didn't know. And so today you maybe you learned something.